I started out to become a general practitioner of medicine, and I often say, and those children were born 2 and 3 o'clock in the morning, and that's probably why I'm not a general practitioner. But anyway, I often said there was never a child born with an interest in academic learning. The children are born developing, and it is what they experience in their environment that promotes development and interest in academic learning and preparation for life, or a lack of preparation for life. And yet we're so focused on academic learning, which is very important, that we forget that it's the overall development of the child that is important. So my work has been to try to link the science of human development to school improvement and reform, but much of it is drawn from my own personal life experience, and that's been supported by my training, my own research, and work in schools. And while science is very important, I draw on that family experience as much as I can, and that experience, along with my what I've learned from public health, psychiatry, child psychiatry, our pilot work in schools, it has formed my position and understanding. What I'd like to do now, as I talk about reflections on race, child development, and school reform, is talk a little bit first about my own background that challenges some of the traditional beliefs and ways of thinking, and then talk about our school development program, our approach to understanding schools and how they can prepare children for their individual lives, lives in the community, and lives in the society, and talk about how that model evolved and how it works, and how it works effectively. But as a psychiatrist, the psychiatrist in me wants to know why we know what to do with children and how to help them perform at a high level, but we're not doing it. And I want to know what's between that knowledge and the actual not giving children what they need. And so I want to think a little bit about that, and then strategy for unlocking the logjam. And because it's so complicated, I won't try to say that much, but I will want to comment on it. Let me start with my background. The understanding underachievement focuses very often on poverty, and underachievement of poor, of non-mainstream children focuses on poverty. And even before that, it was a lot on whether they had the capacity or not. But now capacity is not the question, it's really poverty. But I say it's beyond that. It is whether the historical determinants of underachievement or underdevelopment, underperformance, have really been explored, and have we adequately thought about how we overcome the consequences of past experiences? And I raise that question because I'm from a poor family, and I know that poverty alone is not the issue. Poverty is very important, but it's not the whole issue. My mother and father were from the bottom of the socioeconomic level. My mother was a domestic, and my father was a steel mill laborer. My mother was a child of abuse, all kinds of a range of abuse, and had a very difficult childhood. She had a good father, and he was killed by lightning when she was 6 years of age. And as a result of that, a cruel stepfather came into their lives who was abusive in every way and would not allow the children to go to school. And she eventually ran away to a sister in East Chicago, Indiana, and tried to go to school. But when her sister didn't support it, she had to leave school, become a domestic, and she declared that if I ever have children, I'm going to make certain that they all get a good education. And then she set out to very, very, very carefully find my father. As it turns out, my father had been married once before and had a daughter, and she wasn't sure he was the right one. So she insisted that he get a letter of recommendation from his ex-mother-in-law before she But it worked out well. And the two of them created a family situation that allowed their 5 children to obtain 13 college degrees and have professional careers and contribute to the larger society. My mother had less than 2 years of education. My father less than 6, both in the rural South. She was a domestic, as I mentioned, for 14 years before I was born, and he was a steel mill laborer. I had 3 friends who were just as bright, just as able as anybody in my family. Anybody in the predominantly white, kind of full spectrum socioeconomic school, they were just as bright as anybody in that school. And it was full spectrum because some of the children in that school were children of the people my mother had worked for. We thrived in that environment, and my friends who were just as bright all went on a downhill course. One died early from alcoholism, one spent a good part of his life in jail, and the other was in and out of mental hospitals all of his life. Eventually I realized in my training, and after my change, watching them go downhill, deciding to go to asking the question, what happened, and then what can be done about it, that led me away from general practice into psychiatry, child psychiatry, public health, and eventually focusing on schools. And realized that the only difference, was the quality of the developmental experience that I received at home as opposed to the quality of the developmental experience that they received at home. And I realized eventually that all children, regardless of who they are and where they're from, need a developmental experience in which there is caring, in which the adults promote aspirations, and they facilitate. Then there's a facilitative child rearing that leads to motivation, development, and learning. Now, there's been evidence that this is the way it works from social science for many, many years. But over the last 20 years, 3 decades, neuroscience has shown us that this is the way it works, and that in fact the brain is very plastic, and that all of our interactions with children sculpts that brain and develops and allows us to function increasingly better. And that it works like a house, building a house, that the early structures are laid down through early interactions and early conditions, and on top with more complex interactions, one builds on the other, sets of interactions build on the other.